Hey YouTube, Nurse Leslie here, the Beauty on Duty. Today's video is going to be a quick recap on my first semester in nursing school. Those of you that have seen some of my previous videos know that we did our clinicals in a long-term care facility, and the location that my half of the class went to, the residents' acuity was very, very low. Although it was a very nice facility, I mean, the people just weren't sick. They just pretty much needed lots of assistance with daily living. But the other half of the class, they actually went to a place where the patients were a lot sicker and they needed a lot more nursing care. I actually missed a day in the first semester, so I had to make it up, and that was this past Sunday. So I had the privilege to go to the place where the people were a lot sicker, and oh my gosh, it was amazing. Like, I saw so much within one shift, like things that I hadn't seen for the entire semester, things we learned but never actually got to get the hands-on practice with a real patient. For instance, let's see, oh gosh, there was a guy with an ileostomy. I got to change his bag. There was a patient with a PEG tube who was on continuous enteral feeding. He also had a retention Foley catheter for hematuria as well as urinary retention, so we got to irrigate his Foley. That was awesome. And that guy, he was really, really sick. I mean, he was emaciated, he was aphasic, but we gave him the best nursing care possible, and I think we did a great job. We did multiple dressing changes, which was totally awesome. I feel like an expert now after doing so many sterile dressing changes. There was a lady who was in, I always want to say quarantine, but that's not how we call it. She was in contact isolation, so we had to gown up and glove up before we went into her room because she had MRSA, and it was like really bad. She wasn't following any of the doctor's orders. She was only using tea tree to treat her MRSA infection. So, I mean, we had to wash her skin and apply her ointment and things like that. So, it was really interesting to have my first experience with someone in contact isolation. It was kind of scary, but of course I followed the protocol and everything turned out fine. I did a dressing change on a guy who had cellulitis. That was interesting. He was a really nice guy. I got to talk with him for a little while, but I mean, we saw so much. I feel like this whole semester I was missing out. There was a lady, we had a whole long list of blood glucose readings to do early in the morning, and this one lady, when we did her glucose check, it was like 40. Her blood glucose reading was 40, and my clinical instructor asked her, "Are you feeling dizzy at all? Are you feeling okay?" And she goes, "Well, now that you say something, I kind of do feel a little dizzy." And I'm like, she's got a blood glucose of 40 and she doesn't feel anything until somebody says something? Yeah, okay. But, you know, she had to get her insulin coverage and everything like that, so everybody was fine. But, I mean, we just saw so much. It was incredible, and I just feel so privileged and honored to be able to take care of people when they're in that state, you know, because at the other place, these people, they're just fine. I mean, some of them had dementia, some of them couldn't really move well, but they weren't really sick, you know. So we got to do some real deal nursing stuff, and it was awesome. I hope you guys got the chance to do some of these things too. If you're in your first semester, or if you're pre-nursing, then you can look forward to these things. And yeah, next semester we're doing med surg, so I'm assuming, being in the hospital, we're going to see a whole lot more. So stay tuned for videos about my med surg experience in clinicals, and thank you so much for watching, guys, and I will see you on the next video. Bye bye.